All right. So, what we talked about is the ADC criteria is mixture of traditional and conservative. All right. So, the most important step of root canal treatment by mechanical effect of instrument over the root canal wall may result in iatrogenic damage like transportation, zip or elbow, ledging, apical blockage, loss of working length, perforation, extrusion of debris, instrument fracture. So those are all the things that can happen if our access cavity is not proper, right? So our aim is to avoid those mishaps. Okay, so in that will actually be achievable if we do enhanced visualization of the root canal space by performing proper access cavity. Okay, yeah. So sorry, I'm just reading through the note, but then that's the thing that I wanted to talk to you about, like why it's important. Because as you know, my principle of teaching you the ADC task is not, it's not exam, not for only exam related, like it's about clinical, like practical, like how you'll be as a clinician, you'll be working the task in a patient's mouth. Okay, so that's why I wanted to talk all about these things, that why we need to make a good access cavity, because we want to gain proper access so that we can clean, shape and obturate, and we can prevent all those things that can happen, which is like apical blockage, loss of working length, perforation, extrusion of debris, instrument fracture. Okay, yeah. So what we need, it's very simple. We need just the round bar and Endo Z bar, needle bar, those 3 bars only, and then slow speed round bars, all sizes, get all the sizes, the one mentioned in the ADC handbook. I think it's 0, like starting from 010 to 016. Yeah. So you don't need the largest one, but I think for endo cavity, just to smoothen out the corner of here, so I think 010 is too small, but you can use like 012 or 014. So yeah. All right, let's talk about the criteria itself now. Okay, so first of all is the shape of the access cavity. The outline allow appropriate removal of pulpiform and access to all canals. Okay, so what they said that very good will be outline form has ideal shape. Okay, I was thinking it's recording or not. Yeah. So what's the ideal shape of access cavity? So it's triangular shape. Okay, so usually in one dental tooth we have 3 canals. Okay, you know, in our upper molar it's most complex root system, so it can have up to 5 canals or 6 canals as well, but then 3 basic like main canals. So number 1 is the distal, okay, and then mesiobuccal and palatal. Yeah. So if you look at the tooth, so in a unprepared tooth, if you look, so this is our mesiobuccal cusp. Okay, this is our palatal cusp, and this is our central pit. Okay, and this is our oblique ridge or transverse ridge. Okay, so the canal's location, we need to know the anatomy first, and then we need to know where our canals are located. Okay, so only then you can actually go there and punch it, and then you can so otherwise you will be blindly going where the canals are. Okay, and then you will be overextending. Okay, so for ADC tooth, after preparing many teeth, and then we came to conclusion that the distal canal is located just at the central pit area. Yeah, so just here at the central pit area, and then the mesiobuccal canal, you know, this mesial cusp tip, and then we talked about the cusp ridge and cusp slope. Yeah, so if you look at the cusp ridge from tip to the groove, and it's located at the ridge in between.
Okay. Yeah.
In between, like halfway there.
Halfway? Okay.
Halfway, yeah.
So mesial cusp.
Yeah.
In between the ridge and the
In between the cusp tip and the central groove. And if you look at the palatal cusp now, when you look at the cusp tip, so the palatal canal is located at the cusp tip area,
Okay.
just at the cusp tip area. So I'll show you now. So this is the distal canal
the central bit.
at the central pit. Yeah. And then this is the mesiobuccal canal, which is halfway. So this is the ridge. See, it's half gone. So it's here. Okay. And then see this palatal cusp tip.
Cuspal tip.
Yeah. So it's just here. Okay. So now the one dental tooth that we buy for practice and the tooth they give for exam is different.
Really?
Yes. So the tooth that we get is see, the base is like transparent and it has red and then inside is also red and everything. So the exam tooth is bit smaller in size. The pulp chamber is small, okay, and then the color is also different inside. It's whitish, okay, and the texture is also softer.
Softer.
Yes. Yeah. And then the shape of the access cavity is different as well. Okay. So when we do the one dental preparation, the 2-6 and 1-6.
Yeah, we have to come little this side.
Okay. So when we do the 2-6 and 1-6, so the 2-6 preparation comes like this, this triangle. So you know the triangles. I don't know the English names. So where we have two long hands and one short hand. Yeah. So that's the 2-6 triangle will look like that. Okay. So two long hands, equal long hands, and one short hand.
So the base will be in
Shorter.
the
Yeah.
buccal.
Buccally. Yeah. But for the 1-6, it's all three hands are equal.
Equal.
Yeah.
Okay.
So that's different. But in exam, both for 1-6 and 2-6, all hand equal.
Oh, okay. Okay.
Yes.
It's equal sides.
So that's the shape of the canal. Okay, you can take a look closely.